Hello everyone. We are in conversation with Dr. Priyanka Shivakumaran from King George's Hospital and Dr. Prashanti Shivakumaran from Newham's Hospital. We are going to ask them questions about menstruation for which we really want the answers to from a professional side. So let's jump right in. The first question is, what is your opinion or what do you think is better? Tampons, menstrual cups, or menstrual pads?
Okay, well, in terms of what's better, there isn't that much research done on menstrual cups, but there was a recent study in the Lancet which said that menstrual cups are sometimes more effective at preventing leakages and also still quite safe to use, and it's something that they would suggest it should be an option for women in terms of period pads and tampons. In terms of each of them, they're absolutely to a woman's own preference. Someone's looking for something more eco-friendly, of course, menstrual cups, but you have to know about the downsides where they can be quite difficult to insert. You have to wash them, so you have to probably carry some water with you. But they can be used up to 10 years, just the same cup again and again and again. But the problem with pads and tampons is, again, it's not so eco-friendly. But again, it's up to each woman and how they prefer to use what's comfortable for them.
Okay, that was a rather informative answer. Thank you. So the next question is, menstruators get a lot of cravings during their cycles. Why is that?
So there's not much study again done about why people get cravings during their cycle, but one theory that they hypothesize is that with hormone levels, they're some are high, some are lower, but generally the hormone imbalance that results in ovulation can cause increase in appetite and have these cravings. But actually there's not much research behind why this occurs.
Okay. So the next question is, why do menstruators get pre-period pimples?
Again, it could be something to do with the hormone changes. So I also, the body temperature rises by about a degree during periods, and I guess that's more vulnerable towards infections, I guess, if they're already there. But again, it's not always universal with ladies. It's one of those hormone things where people do happen to get pimples.
Okay. The next question is a very common question which we got from all our volunteers, asking for a reason why periods are late.
Okay, so in terms of why they're late, often it can be due to a range of things. So if they're late, on occasion, so by a week, 2 weeks, there are many things. Stress can actually change period cycles, losing weight or even gaining weight, exercise, all these things can cause it, as well as hormone imbalance and things like the thyroid function. Of course, if people might be pregnant, that's another reason. But overall, you can give about a week, 2 weeks of saying, okay, that's acceptable. But if this happens often, if it's very late and it's very for a good few months, and you haven't changed much in terms of your lifestyle, then I do suggest you go see your doctor and try and work out why this is happening.
Okay, so another question is, what is PMS? And could you elaborate a little more on it, and does it actually exist?
Okay, so PMS does exist. It affects around 1 in 20 women, and it can vary from mild symptoms or no symptoms to features that are quite debilitating and really affects the quality of life of the woman. You can broadly divide it into physical features, so they get bloating, feet swelling, general aches, or mental features, which includes irritability, tearful, being quite low in mood. And one of the reasons that, again, they think is it could be hormone imbalance again, and also serotonin levels. So one of the ways that they try to treat PMS, especially if it's affecting the woman, is to give them certain antidepressants that increase the level of serotonin in your body. But there are various ways of trying to treat PMS. One being, or trying to reduce the effects, reducing caffeine intake, exercise, but also cognitive behavioral therapy. So yeah, it does exist and it varies.
Okay, that was interesting. Now, another very common question is, what is considered as a normal menstrual cycle?
Okay, so a normal menstrual cycle usually has a regular time frame between each menstruation, so 28 days is one of the things, but it can vary between, I think, 21 to a bit over, I can't remember, 32 days. And during that, they're bleeding for, again, with women it can range from 3 days to 7 days. But the main thing with menstrual cycle is that it's between the 21 to 32 days, and it's regular. That's what means that it's a regular cycle. And the bleeding is one that it usually lasts for the same time. It's a bit abnormal if you bleed in between cycles or have a bit of spotting. That's not so normal, but the main thing is the time.
Now the next question is, what is PCOS and PCOD? What's the difference and how does it affect the menstrual cycle?
Well, I'm more familiar with the term PCOS, which stands for polycystic ovarian syndrome, and here it's diagnosed via three criteria. So there are 12 cysts raw in the ovaries, and that's found out by an ultrasound. If women have features of polycystic ovarian syndrome, so that means hirsutism, which means hair in places that you normally don't expect, something on like the chin or the lip area, and then also I think very infrequent periods or no periods, and well, it's actually quite common. Like I think 33% of women do have some of the features of polycystic ovarian syndrome, but not all of them are symptomatic. It's something that doesn't bother them, and it's usually, how you also notice this, people who tend to have it are a bit overweight, and yeah, they're a bit overweight, and they have hair in places that are unusual for them. Their periods are irregular, or not as frequent as it should be. And actually the mainstay of helping people with polycystic ovarian syndrome is actually weight loss, because insulin resistance is something else that triggers the symptoms, and so losing weight alone can sometimes help people. Sometimes people can take again the combined oral contraceptive pill as a way of regulating the hormones, and again there are many different treatments for different circumstances. Sometimes people are put on something called metformin, which is used in diabetics, and there are different sort of I think treatments that at a more specialist level, like a gynecologist can provide, which can help with conceiving, help with having a normal cycle. But I think always the mainstay is trying to lose weight to be at a normal range. It's okay if you're at a normal range and you've tried everything, then of course go for further treatment.
Okay. Now the next question is, what is a pap smear test and why does one need to do it, and how often do they have to do it?
So a smear test is a way of looking at the cells at a microscopic level that's inside the cervix, and with young women, especially those who are sexually active, they can cause some changes in the cervix lining or the cells. So there's a level of dysplasia, meaning that the cells can be abnormal, and they're categorized into three levels. Type 1 isn't actually too worrying. It's sometimes even seen in, just generalized in, young women. But type 2 and type 3 need follow-up, because the reason that they do it is to look for if there's any precancerous growth or is there an increased chance of cancer. And one of the causes is actually from certain viruses. So there's a herpes? Or is it human
papilloma?
No, it's human papilloma viruses that can cause these changes. So I normally hear they do it after the age of 25, only because younger than that, it can give a false positive, meaning when they do the smear, it can look abnormal, but actually it might be normal just because it's a young person and the physiology can cause this to happen. And then after that, it's usually every 4 years or 3 years. I can't remember off the top of my head.
Probably 3 years actually.
Yeah, but they do it at regular intervals until I think the age of 65, or even less than that.
I forget all the ages.
All the ages, but then so they do it until a certain time, and after which the risk of getting this type of cancer, cervical cancer, reduces. So first, if it comes back abnormal on the smear, then they have something called a colposcopy, which it takes a small chunk of the cervix lining, and then they have a more detailed look to assess, is it cancerous, how much is the spread, and so on.
Okay. Now our next question is, okay, so now our last question is, are there any red flags or any tips you could give us, or give our viewers, where whether they have to consult their doctors, or some tips to make sure your period cycle is normal?
So yeah, there are a few red flags to look out for. The first one is to quantity of your blood flow. So if you are changing pads or tampons every 2 hours, very heavy bleeding, that's actually a cause for concern, because there's quite a bit of blood loss and it's really impacting your quality of life, and that's something to definitely be mindful and consult your GP or your family doctor. The other thing to think about is what Priyanka mentioned earlier, talking about irregular cycles. So there are many things that can cause your cycles to be irregular, including stress, if your sleep cycle's disturbed. And so normally our body will then readjust itself and it can come back to a regular pattern. But if it's consistently irregular, it's definitely important to go and consult your family doctor. The other thing to even consider is actually when your periods stop for 6 months or more, or there are times where you've just been constantly not having periods for quite a while. One, of course, could be that you're pregnant, but there could be other reasons too. Some genetic conditions, some endocrine conditions such as thyroid disorders, which can predispose you to having this. So it's important to just go and consult the family doctor about this.
Okay, so that's all. Thank you so much for joining us today. It's indeed been a very informative session. So thank you so much.
Well, thank you for having us. Thank you.